the webinar today. We are poised to kind of talk about Phoebe Putney Health System down in Georgia and how Phoebe is tackling kind of the new hospital expansion. We will go through a list of topics today, which I'll kind of talk about here in a moment, as well as introductions, but please feel free to use the chat bot, the Q&A, to kind of submit questions. We will try to answer them as we work our way through the presentation or at the end of the presentation. So my name is Adam Binford. I am the Director of Client Development here at Vivian Health. Vivian Health is the largest clinical talent marketplace, similar in scope to like an Indeed or LinkedIn, but specific to clinicians. And I'm very happy to be joined with Bruce Mattis today. Bruce, please feel free to introduce yourself and Phoebe Putney Health System.
Good afternoon or good morning, wherever you're calling in from. I'm the System Director of Talent Acquisition for the Phoebe Putney Health System in beautiful Southwest Georgia. And thank you for having me on, Adam and Victoria.
Absolutely. So just the agenda for today, I do want to provide you with a brief overview on Vivian Health quickly. Then secondly, kind of move to Bruce and really talk about Phoebe Putney, both in terms of their strategy for retention, some of the TA challenges that they are currently tackling, and then lastly, what is their strategy as they are building a new tower at the health system. Finally, just talk a bit more about Vivian and end with answering any other additional questions. So just to start again, as I mentioned earlier, Vivian Health is the largest and fastest growing marketplace for clinical talent. We were founded in 2017, acquired by IAC, which is a publicly traded company. IAC does invest in marketplace technologies. As you find a couple brands here in front of you, Care.com, Angie's List, Match.com. Hopefully these are household names. They all are essentially marketplaces that connect some sort of business with an end consumer. Vivian Health is that, but for, again, clinicians. So we do work with over 90 health systems today, about 90% of staffing agencies, and support an array of roles across nursing to allied health to advanced practice. So we'll turn now to Bruce, talking about some of your retention strategies here. First and foremost, would you just mind sharing a bit, like a high-level overview on Phoebe Putney Health System, what challenges you're facing in terms of retention, and has this changed over the last couple of years to where we are today?
Sure. Adam, real quick, Phoebe Putney Health System, we are a independently owned and operated nonprofit community health system in rural Southwest Georgia. We have 4 hospitals, close to 60 clinics, and about 5,000 employees. And we've been running operations here for over 110 years. And we truly are a health system that's committed to the community that we serve. Like anyone else out there, there's a war on talent. And you have seen a lot of movement coming over the past 2 to 3 years coming out of COVID as people want to try to find out where they are, what they want to do with their career. And we've seen a significant amount of clinical movement due to just uncertainties with vaccinations, uncertainties with regards to poor performing facilities because of finances. But one of the interesting things that's happening now, we see job transitioning has started to slow down as it relates to us being in an election year. I think there is some uncertainty with what's going to happen. No matter where you sit on the election spectrum, right, left, middle, you still want to have some stability in yourself. And so there is kind of a wait and see approach for folks, maybe until after the election. The other thing that we cyclically hit is a lot of people aren't in the mode of transitioning jobs right now during this time of year because we're right up against the holidays. And so you see that tend to slow down until after January. And another reason for that is the tax breaks. The majority of your taxes that you pay with your first $13,000, and that's usually going to be done in your first couple months of the calendar year. So we see a lot of people hesitant, and then also people that may be awaiting bonuses and other incentive programs are going to wait until after the holidays. So we've seen some market fluctuations. The economy it's not that it's rebounding, and I'll let the economic experts get into that, but it's not ripe right now for people to want to make a job change. So a lot of companies aren't changing their compensation plans. So there's not a lot of movement out there because people aren't offering more salaries. We're not seeing a rise in sign-on bonuses. So it's going to be up to individual companies to stand out, Adam. by what they offer in-house and just some of the things that they're doing to keep people to stay with them.
Yeah. Yeah, it's a really great overview and kind of lay of the land. And I think, even outside of healthcare, we're seeing similar again in kind of the tech market and others in terms of just hiring slowdowns and people just kind of staying where they are. In terms of some of your programs, do you mind kind of elaborating or sharing a bit more about some of I guess the programs that you currently have in place to help with retention?
Yeah, so from a retention perspective, it comes back to internal staff development, what you're doing to keep your people here. So internal training programs, we have something called here InStep, and that is our new grad residency training program. Something that we do to keep new grad nurses, to get them trained, to put them on a career pathway, as well as to rapidly get those new grads trained into the area that they're going to go into. So as an organization, we hire people right into specialty units. We don't wait until someone completes their new grad residency and then move them. We start training them right out of the gate in those areas. A couple of the things that we're doing, I think, that are unique is we have several different tiers of leadership development programs where we train folks to get to the supervisor manager level, to get folks to the director level, and to get people above that director to the VP level. So we have an investment with the University of Georgia University System to help us out with that. And those programs are a year long, and it's a significant investment on the part of the health system. We also have created career pathways for our staff that starts with our entry level positions that are both clinical and non-clinical, that can take people through different levels, education that we can do, reimbursement. And we also have partnerships with other universities and the technical college system here where we can help get people certified, we can get them trained, as well as take them through their clinical rotations. So upskilling your staff, I think should be a priority for everyone right now, especially with people wanting to feel rewarded. And I think one last thing is really taking the time to train our leaders to be engaged with their staff, to treat their staff with dignity and respect, and to create a fun work culture where people enjoy coming in. We all have to make that paycheck, but if you enjoy that work, the angst goes away.
Yeah, I couldn't agree more. You spoke about leadership development a little bit. I know that, when we spoke before, you kind of talked about the LEAD program at Phoebe Putney. Do you mind kind of speaking about this in a bit more detail?
Yeah, our LEAD program was developed out of our organizational development and our learning team. That program started, I believe, about 15 years ago. And what happens when and this could be in more urban cities, but in rural locations, there is not a lot of talent in your market. And so many times you're going to have to home grow what you have. Now, last man standing is not the best pathway to promote someone into a leadership role. So we had developed a program to start arming our staff with tools to become better leaders, preparing people for those leadership roles. And it's classroom-based activities for a year. So once a month, each of the people that participate in the different levels will go into a classroom setting where there are facilitators hitting different topics. There's interactive components. There's project work that each of these pods have to go through, or cohorts. And it's important for people to share and exchange ideas. The interesting thing about the project work for the Lead 2 and Lead 3 programs, those are projects that the organization adapts into our business model. There are things that we can use to help save money, improve efficiency and effectiveness. So the action plans that our employee students are working on are things that we're going to apply in the real world. It's not pie in the sky. It's not nice to have. It's things that we're actually training them on. And also for our very entry-level lead program, getting those people to shadow with other leaders, getting them to take on job enrichment, stretch projects and things to help apply the things that they've learned. So it's committing to developing staff.
Yeah, makes a lot of sense. Because I assume, again, based on your location, not being in Atlanta or like a major metropolitan area where there's a lot of competition, maybe not so much of a revolving door, but maybe more kind of clinicians coming in and out, you really have to take the time to, with the people that are kind of living in the area, relocating, keeping them and developing them internally. So it's great to see kind of this LEAD program and the others that you have.
Yes. Yeah, and I think I missed something. I'm sorry on the one of the things I wanted to point out on the residency program on the slide before this, just so people understand. Our first 8 weeks with those new grad nurses is an intensive. The first 12 weeks, excuse me, are just an intensive program that develops them on all of our protocols, our nursing practices. It also has to do with the computerized training, and it establishes the components that you've got listed there. We also take our travel nurses through a similar or smaller program, but they're working in the units, but we're also training them as we go so we can immerse them in it. Because part of that nurse simulation and training program, it's to train and develop them for patient care and delivering an excellent experience. And I think that you're going to see more organizations investing in large scale simulation labs just to get people up and running, but having them be more confident in their abilities to tackle the things that come up. So our simulation rooms are real life situations. The mannequins can be programmed to do certain things, and then in turn, the nurse has to respond to that with how it would be. And so we can actually, gives us an environment where we can fail. It gives us an environment where we can make mistakes so we can learn from that. So thank you very much for that. Going back, Adam.
Yeah, absolutely. No, it's a great point, and it's a great standout for Phoebe Putney as well. Again, you spoke about a little bit about career pathing. So do you kind of mind walking us through some of the different career paths that you have for, the candidates that are joining?
Sure. So, we're a net neutral population region, which means that we're not growing. We're not growing in adding people moving to the area. So it's not necessarily a destination city or a series of townships. So we have a lot of entry-level people coming out of high school that may not be looking to go to a four-year college or may not be looking to go into a trade school or a technical college. So we do have entry-level jobs that require, in most cases, a GED. And then some of them may require certain certifications. So we've set up pathways to welcome those people, to provide them with training, to give them something that they can strive towards. So it's not just, hey, here's your job, come talk to us in 5 to 7 years. It's every few years they have something that they can move towards as long as they're gaining the knowledge, skills, and abilities that they need. And we've set this up. Our pathways, we can take people coming into the organization with an associate's degree or a technical degree, where that they could start what they can grow to, as well as that bachelor's degree and then even advanced degrees, because folks that might be a physician assistant, might be a nurse practitioner, they can train towards being a director, coming back on the hospitalist side or into the clinic side. So it's giving people something that they could strive for. LinkedIn in 2010 said that we will start moving towards tour of duties in the workplace, where people will work 2 to 3 years in their given job, and then they're going to want to move on, whether it's upward or laterally. We've provided that through our career pathways so people have something to look forward to. That is a key piece to retaining your talent. You invest so much money in getting somebody up and running. If there's not a reward for them several years down the line, they're going to look elsewhere, even in a rural market. So the key there is it's not the carrot, it's not only are we going to train you, we're going to have you work towards something, and we'll get you there. And we're paying, we have a robust tuition assistance program. We also qualify for several different federal programs and state programs where you can get loan forgiveness. So I think it's important for organizations to really look at what they're doing on the pathway side, because otherwise you're training somebody and then they're going to go somewhere else. And in your urban markets, for example, Sacramento has 6 different hospital systems in that market. And what's happening is you're seeing people just jump between different organizations because there may not be a pathway for them.
Yeah, that's fantastic. And I think, candidates always have options, to your point. Like even in a smaller market, there's still going to be options. And I think a lot of sometimes think that a higher salary is kind of the flashy thing in the beginning, which may be true. But if you do have appropriate career pathways and pathways for people to kind of progress, that can be much more important than just the highest paying role in the market.
Absolutely.
So that kind of ends the discussion around like nurse retention. Again, if there's any questions, please feel free to place them in the Q&A and we'll be sure to address them. But really just shifting over now to some of the challenges. So I'd love to kind of hear more about some of the talent acquisition challenges that you're facing, and kind of what the team's doing, both in terms of, again, recruiting in a rural market, some of the technology that you're using to support, again, finding any sort of net new clinicians that you can.
Yeah, Adam, I think right now there is a true war on talent. We have still a strong percentage of nurses that are out doing travel nursing. If we could convert all those nurses, I think it would certainly shrink our shortage. But I think that there is a certain outstanding piece to having those professional nurses come in and assist you in your time of need for seasonal spikes. However, with us not having enough talent in our local body, one, you got to either grow it or you've got to go out and find it. And so we are doing both. In order for us to go out and find the talent, we have to go to other marketplaces. So one, we're going to similar rural communities in similar markets. We also go to other communities like Montgomery. I think it's not a sneaky thing to do, but reaching out to folks that live in North Dakota and Minnesota and upstate New York, we have a very mild winter here. So it's, come to a warm weather climb where you're 2.5 hours away from some of the most pristine Gulf beaches in the United States, near Panama City Beach. So I think you need to sell the geography for people, but you also need to sell a lifestyle. But how do you find the people? That's the trick. And I think we got here leveraging tools that have artificial intelligence, leveraging your own applicant tracking system, where other think tanks out there say that approximately 80% of your candidates could very well be in your own database. And so we have to mine our own database. And I'll tell you this right now, leveraging a partner like Vivian is a way that you're going to have to start looking at. You need somebody that has invested in building up a robust database that is targeting clinicians and ancillary folks that you can bring to the table, because it's very difficult to do this all on your own. So you have to have multiple things in that tool belt. But it starts with the things that you've got here on the slide. And I think people, they need to be open to trying new things, because the status quo doesn't work. So challenge the status quo and look at some new things.
That's great, and appreciate the shout out. One other point on this too. I mean, I know artificial intelligence has become extremely popular, both, across the world now, but specifically within recruiting. Are you all using any sort of artificial intelligence in order to kind of support either screening, sourcing, or anything at the health system, or is it still kind of a work in progress currently?
Sure, we're doing it on the light side. A couple of the technologies that we use has AI incorporated in it to help us do our searches, help us narrow the talent pool that we're looking at. So putting in knockout criteria. It's not embedded into our Taleo applicant tracking system. So our searches there are manual, but that's okay. It's still a database that we have. But I think that you have to have some partners and some tools that you can use that have some of the great bells and whistles, because there's a lot of amazing talent out there. It's just uncovering it. And I think that everybody's a passive candidate unless you're actively looking. But there may be an active candidate out there, but if they're not contacting you and applying to your jobs, they're passive to you. So utilize things that can help find someone that's a nurse, even though their resume may say that they live in Alabama, Mississippi, North Dakota, Wyoming. It's someone that you should still target. You should still send them information. If you're not trying, you're not going to be getting, it's better to get a no, not interested, than just sit there and twiddle your thumbs. So new ideas always help you out.
Right. So just shifting over, I know, again, got your work cut out for you now with the hospital expansion. Can you kind of paint the picture for us in terms of the project that's at hand now, and how many clinicians are you looking to hire in the near term here?
Yeah, it's exciting times. So we have a $100+ million expansion going at our Phoebe Putney Memorial Hospital in Albany, Georgia. We call it our main campus. We're licensed for close to 500 beds here. The exciting thing is we are opening a brand new tower, and that tower right now will have 3 units will be in that tower. So the first floor is our welcome piece to the community, and that would be the emergency center. So any hospital knows that that's the welcome piece. That's where many people in your community are going to utilize services there. So an expansive suite, having several trauma suites in there where we can just do the procedures that we need. Right now, we're licensed for 36 beds in our NICU, and we're going to 50 in this new NICU. We're the level 3 regional perinatology center for Southwest Georgia. So we're the ones that deliver all those early neonates. And so having a state-of-the-art equipment, having a brand new facility, especially when we're almost always at capacity, and then a new state-of-the-art ICU, and having this all in one tower so we can move patients through that continuum of care. Because if someone comes into the emergency room and is not going to leave, if they're going to stay with us, we need to get them to that next level of care quickly. And so having a state-of-the-art tower for this, we are a level 2 trauma center. We just got that designation within the past year. And so having all that in one building is going to be fantastic, and just shows our commitment to the community. So it means that we're going to hire over 60 new clinicians, not just nurses, nursing support, imaging, lab. It's just going to mean, a bigger handprint in the community. And I think the great thing is we're going to be able to treat more patients and deliver better service to our community. That's the ultimate goal.
That's great. I know you had mentioned before, there's a couple different techniques you're doing in order to, again, not only staff for the new unit, but also just in general. So do you kind of mind walking us through some of the different techniques that you're using outside of?
Yeah, thank you. So I think that organizations, if someone out there in any of the hospitals in the United States or abroad has the silver bullet for bringing talent in quickly that wants to stay with you, I'd love to have it. But we've had to create our own silver bullet here in Albany, Georgia, and it comes with multiple pieces. After you have gone through your own database, after you've gone through your relative applicant pools, there's things that you have to do. So doing virtual recruitment, and virtual recruitment comes in multiple ways. We're leveraging a technology so we can have people give us video interviews, recorded video interviews, so we can move through evaluating those people quicker to see if they're in line with what we're trying to build here. Also, doing virtual recruitment out of the state, because people aren't, not necessarily going to drive here if they're 4, 5, 6 hours plus away. So meeting people through the technologies that you have, and then also attending. There's a lot of universities for their alumni base, and there's some other community-based organizations that are hosting virtual events, and attending those virtual-based events so you can meet people, you can tell them about your facilities. The other piece with virtual is you got to put your robust pictures and imaging out on your career page so people can come and visit you. They can see what you're all about. The second piece, community partnerships. Right now, we're working with close to 10 different schools on a regional basis: nursing, pharmacy, medical school, CNAs, so nursing assistants, medical assistants, imaging and lab partners. And it's a significant investment for our organization. And then there's also even non-universities or non-schools that are, their pro certification programs, and it's partnering with them to give those students the opportunity to clinically rotate in our facilities so they can get firsthand experience. They can see our very, very renowned and state-of-the-art simulation lab. Now, we just opened a living and learning center, first of its kind in our part of the United States, where the first floor is the nursing school from one of our academic partners. That's their nursing school. The medical school's there, the pharmacy school's there, but we have classrooms, we have office space, we have lab space, we have areas the students can debrief and wind down. So that first floor, it's all geared towards learning. And then the second and third floor is apartments where our residents, those student residents, can live, and they can stay there with an agreement with us to work on the back end after they finish the school. So that's the level of community partnerships that we're doing. We're bringing those partners in to help, and we want to get there. We want to get those students to come join us. Everybody needs to have an employer referral program. It's one of the most underutilized things, I think, across the United States, because Adam, you and I, in our personal lives, if we have some of our close friends, we're not going to refer those that we don't think will impact. I'm always going to bring and encourage my friend Jim to come wherever I'm at, because he's just an amazing person. He embodies and lives those values. That's a person that I would bring to Phoebe. Well, each of us are passionate about some of those friends, those people that we go to church with, those people that we're on the parent soccer sideline with, the different community groups that we belong to in our children's classmates. Well, we need to build that, and that referral program needs to be robust. So it's less about how much the reward is, but we do have good rewards for our staff, and it's more about bringing great people in to treat the community, finding like-minded people, but also finding diverse folks. Lastly, social media, it can't be stated enough. When it started to hit the marketplace about 2005, when LinkedIn and Facebook started to first eke themselves out. Now, if you don't have a social media campaign that has Facebook, has X, has LinkedIn, has TikTok, has Snapchat, and there's so many more, but aren't leveraging that and aren't leveraging some of your staff that are influencers, having them put the word out there about what a great organization it is, the cool things that you're doing in the community, and just how you innovate and how you make it a great place to work. Because honestly, that's where the stories are going. Diane Sawyer isn't telling it about it on the nighttime news, and I just probably aged myself by dropping that name, and you're not learning about it on ESPN. So you need to put it out in the venues that the current up and coming generations are looking at. And so banner ads, visual things, having people tell the stories, Instagram threads, there's so many that are out there. You do need to narrow it at some point and take a stab. So those are the different innovations that we're leveraging and utilizing right now. And there's more. It's just your focus can only be so much.
Yeah. No, that's great. And that's a great synopsis for some of your strategies. And I think echo the point that word of mouth is one of the best ways to kind of enhance what you're doing and obviously drive more leads, followed by social media. It's something that we do here, and you're just seeing the rise of TikTok and Instagram and other sources to help promote things across the globe.
Yeah. And there's some great recipes on TikTok.
Yeah, funny videos there. I know you talked a bit about mining kind of your own internal database, but any additional kind of points you want to kind of call out here? Are you finding with this expansion, some of the candidates that you're looking to hire are coming kind of from your internal database that you've built up already?
Yeah, we've got that up there. Sherm talks about 80% of hires are in your own database. The National Association of Healthcare Recruiters has put out a similar stat. And, Rogue Hire, one of the big think tanks in collecting data just respective to talent acquisition, they are talking and promoting about how you got to dig into your own well, and that well is your database. So for myself, recently we've had a couple of successful hires that had applied several years ago, and for whatever reason didn't take the job then. Maybe it was COVID, I'm not sure, but reconnecting with that person, and they hadn't applied to anything recently, reconnecting with those people have netted us several hires, and we're going to continue to do that, especially we've got probably 10 plus years of information in a database, so why not use it? And I think it's flattering to people say, hey, we're still thinking about you, not sure what happened 5, 6, 7 years, 2, 3 years ago, but we'd love to consider you for this upcoming job. Here's some things that have changed here at Phoebe since you've been gone. Come take a look. And it all comes back to messaging as well. I don't think a lot of people want to be the bridesmaid or the silver medalist, but if you approach them with a fresh perspective and say, hey, we're interested, that also kind of helps with that. So find the people in your database. They're there. And even look at your past employees. Some of them didn't leave for bad reasons. Some of them moved out of the area. Some of them had to take a job transfer. Somebody left the workplace to take care of a family member or a child. Now they're ready to come back to work. Tap into it.
Yeah, that's great. No, and honestly, couldn't agree. I mean, there's a lot of truth to most, a lot of these hires are already in your database. we try to pride ourselves here on the fact that although, again, many candidates in the region, in your region are already in your database, we can kind of support with delivering some unique candidates that are outside of that. And just to wrap up, again, in terms of diversity, equity, and inclusion, can you kind of walk us through how you're including that in the hiring process here?
Yeah, I think there's just been some negative connotations with DEI initiatives. I think each organization out there needs to take a deep look at why you do diversity recruitment, why you have diversity representation. It comes back to engagement. It comes back to holding your organization accountable for equitable nature, for inclusivity and belonging. Our initiative that we started about 4 years ago was one to develop a robust, inclusive interview training that anyone that is touching an interview at Phoebe Putney Health System gets that training. So we rolled it out to managers. And then after we did that initial run with directors and managers and leaders, then we started rolling it out and opening it up to supervisors and other staff. So getting people trained to address biases, rating errors, your mannerisms, your body language. So you got to have diversity questions in the mix. So you have to have some questions about what's an inclusive work environment for you. How have you affected it? How have you championed diversity in your role? Or what is diversity to you? And having diversity of panelists. So if you have a finance position, for example, open at your organization, do you have someone from IT on there? Do you have somebody from nursing on there? Do you have somebody from patient registration sitting on that interview panel? So have diverse representation on that panel. At Phoebe, we have a diversity council representative on every manager and above interview. And every interview at Phoebe has a diversity question in the process. And that's important to us. The other thing is just having a robust interview guide, putting it out there so you treat everybody fairly in that process, and you have great questions that are either behavioral based or situational based, so you can get the right people. A bad hire is no good for you, and you've invested so much time, as has the candidate. So having that diversity component tied in through our hiring process has been an important journey. And I'm very thankful for Dr. Jennifer Williams for working with us and giving us the opportunity to develop some things and roll it out to the health system. She championed it, and it's a great executive sponsor to have. So yeah, great question, Adam.
Thank you. Well, thanks a lot, Bruce. I really appreciate that. And thank you for covering kind of all the topics around your new hospital expansion, retention, and some of your strategies. I just want to turn it over now to kind of provide a quick overview, a few minutes on, Vivian Health for those that are less familiar with us. So as I mentioned before, we are the largest and fastest growing marketplace for clinical talent. Today, we have about 2.1 million clinicians that are using our platform. These are, when I look at Vivian, we are not so much a database. That all the candidates that we're quoting here are candidates that have actively logged in the previous few months. We do support, a number of different types of roles and employers on the platform. So about 1.2 million of these candidates are interested in perm or PRN, and probably even more so that have not said that they are interested in that as well. In addition, we have around 1,800 candidates kind of signing up daily. We get that sign up number due to a couple of different ways. So what we have to do on our end is really create a platform that makes sense and is easier to use for candidates. So first and foremost, we do post pay information for all roles on the platform. We do not do this in order to kind of create competition across employers. We do this more so because we hear from candidates time and time again that they want to have this sort of expectation set before they kind of start the process, applying the ATS, etc. For candidates, they can easily compare jobs. So they can kind of come to one marketplace, look at an array of jobs, and compare roles across benefits, location, shift, time, a number of different ways. Again, they can chat with recruiters. They can download the mobile app, chat with recruiters or sourcers, again, prior to actually going in and applying to the ATS. And they're receiving job matches to them based on their profile and based on their search activity. So they don't actually have to go to a database and look for different roles. They don't have to go to different career sites. They will receive job matches to them based on their work experience and what sort of role they're interested in. They can also use this profile to apply to a number of different roles. So that's kind of the value that we're bringing to candidates and why we've been able to amass about 2.1 million clinicians today. We do support a number of employers across the country, ranging from acute care providers that are national or more regional. Again, we support about 90% of all staffing agencies use the platform. We work with for-profit, employers as well as RPOs. Just quickly, in terms of how the platform actually works as well, on the left-hand side here, you can see a candidate's profile. So most candidates are actually, instead of using like the web-based browser, they're just downloading the mobile app, either from the iTunes or Android store. From there, they're uploading their phone number, email address, what type of role they're interested in. Is it a perm job? Is it PRN? Is it a local contract, travel contract? And then additionally, uploading their licenses, certifications, work experience. On the right-hand side, you can see we partner with employers to post roles. We will standardize job types on the platform. So you can see here it's ED, RN, a location, pay transparency, again, in the form of either a starting at rate or a pay range, the shift, hours, and any other information. What we do is once we have that data set from the employer and we have a candidate's profile and their search activity, we can then start to match jobs. So in the case, if a candidate is looking for a role outside of their location which they're living, we're not going to push a role to them based on where they're located, given that their search activity in the platform is telling us something otherwise. Additionally, we want to make sure that we're pushing them accurate roles based on the type of profile that they have. Once candidates click on a job to begin the process, they'll go through a layer of screening, confirming the specific location, certifications, type of role. Because again, for the value to recruiters and sourcers, we don't want to send just anyone that kind of clicks on your role over to you. We know your time is valuable. So we are screening out a lot of these candidates and sending only those that have kind of made it through the screening process to your team. And then it's up to kind of the recruiters or sources from there to engage with the candidates, chat with them, and then kind of move them over to apply directly in the career site. Lastly, the types of roles available on Vivian, less than half of the entire talent pool is going to be RNs. We can also support LPNs, CNAs, we have quite a few. Allied health, we know, is very, very popular right now. Respiratory therapists, all sorts of tech roles, imaging, phlebotomists, etc. It's about 30% of our entire talent pool. Outside of that, again, we do have advanced practice, which is a growing segment for us as well. I want to stop here and just see if there's any questions that we can kind of answer, kind of going back to some of the topics that we covered today on retention, some of the hiring, but I'll take a pause here for a moment.
So while you're looking that up, Adam, I definitely wanted to piggyback. Our use of Vivian was easy for our team members. It was easy to access. It was easy to use. We were spoon-fed candidates, and I'm appreciative for the clinicians that the Vivian team was able to find for Phoebe, and they're still here working for us today. So I think if you're looking for something easy to use, if you're looking for a partner that listens to your organization and is willing to partner with you off of the values that you have, such as community, such as service, I think that I can't think of a better partner to have gone down the path with. So I am thankful for you. All right, Adam, I'll shut up.
No, that's great. Thank you so much, Bruce. I really appreciate that. Truly, it's been a great partnership. Well, it sounds like we're all set. Bruce, thank you so much for the time today. Again, it's been very insightful. I hope the audience has found this very helpful as well. Feel free to get in touch with me if you'd like to talk. I can also put you in touch with Bruce if there's any questions outside of this. But thank you so much, Bruce. We really appreciate this.
Thank you, Adam.
Everybody.
All right. Have a great day.